Well, here I am, the professional cancer patient. I'm seeing quite a few departments. I see them in ear, nose and throat, ENT departments, who keep a constant monitoring of my situation. Unfortunately, I've developed tinnitus. It's come out of the treatment, especially from the radiology, and tinnitus is a problem within the brain rather than the ear itself, and I have cicadas, very loud ones, buzzing away in my head. So I have the audiology department to deal with as well. I have tried hearing aids, they don't work. In fact, they're very uncomfortable and I prefer not to bother with them. And I'm losing hearing in my other ear as well, which would be typical of someone my age. So it's not an easy ride, but I'm less concerned about that because quite frankly, the way the world is, hearing less is probably better. And then I have to see the dermatologist, different surgery departments. Since the nivolumab finished, I've had a lot of skin cancers come out, including another melanoma. I had it here on the arm. You might be able to see the sort of graph site there. And that's an odd thing. I mean, if you look at pictures of me around the time I was having the nivolumab, you don't see any cancers developing. As soon as the psoriasis finished, which was another side effect of the nivolumab, it made 225 really miserable for me because I had it over 60% of my body. And that just told everyone that the nivolumab was doing its job because it's a side effect. And then once the psoriasis cleared, suddenly all these cancers, all these skin cancers began to grow, and I had them all over my face, and I had to go to the plastic surgeon and have a lot of them removed. And then you use that medication called Aldara. It's a type of cream you apply. It turns the skin very red and crusty, but it basically gets rid of all the cancerous material around the site like that. And that's particularly useful in the irradiated areas here because I have no feeling in these places and things can develop and injuries happen and I'm not going to feel it. A doctor can put a needle right into my neck here and I don't feel anything. It's one of those things, you know, you've had cancer and you really do know it. At least my hair has started to grow back, which is good. So I see all these doctors all the time, and of course there's my own GP, and one of the things that you learn is, yes, hospitals operate in a way which is not very holistic. Departments don't necessarily work together. For example, when I see my oncologist, I'm supposed to have a PET scan, but they make an appointment with me and they don't arrange the PET scan. Now, the PET scan's a big deal because you've got to have radioactive materials brought in, and I tried to ask for a navigation nurse, but they don't have that facility. So I've got to sort of chase these things through myself, which means changing appointments, sort of talking over the phone with people who, you know, they don't seem to quite get it, what a nuisance it really is to make one appointment without checking to make sure I've got the necessary x-ray so the oncologist can sort of say, well, that looks good. And then you have to consider all the time you waste on this to and from the hospital. You know, that's why I call it being a professional patient. You know, you have a lot of time. I'm filling my life up the best way I can. I'm painting my pictures, I do my garden, I look after my house, and if the worst comes to the worst, and it does recur in a very big way, well, I'm pretty well prepared for it, because that's the trouble with metastatic cancer, is that the there's a very high chance it could return. And in fact, the specialists, the last one I saw only a couple of months ago, the first thing they tell you is that people like me usually die. And you've got to think about that. I mean, I find that a bit cheerless, and I sort of wonder why they rush in to tell me. I think they could be a bit more subtle about it, but you know, that's hospitals for you. And so I am moving on. It's winter at the moment. You wouldn't know it because this is the tropics, so it's quite mild and comfortable. And I'm walking a lot. I do a lot of walking. I can walk 30 to 40 kilometres in a day if necessary. Okay, I'll catch you up next time. Thank you.